Well, thank you very much for inviting us to present not a legislation. I'm not going to talk about a new legislation or whatever legislation. What I'm going to speak today is about a new initiative that the Commission has identified as one of the most important projects. And this is how to translate innovation in reality for benefits for patients, citizens, and companies. This is framed in the Strategy 2020 and in particular on the Innovation Union. In the Innovation Union has been said that in Europe we failed to deploy innovation. We failed and our companies and our citizens are suffering for it. So we propose to the head of states that we need to address the things in a different way. Because in some of the cases, it was about the implementation, not just about the public authorities, but about a different sort of important stakeholders that have to do their work. The first proposal we did is to establish an innovation European partnership on societal challenges. And what we propose from the area of health and consumers, but also digital agenda and research, is to focus on one of the most important societal challenges we have and we will have for the next coming years, which is the aging population. This is why what we are going developing now, and we are developing with you as well, is called European Innovation Partnership for Active and Healthy Aging. And this is what I would like to present you this afternoon. This innovation partnership, of course, is a public and private partnership. It's not just the Commission, it's not just the Member States. It's about industry, it's about patients, it's about health professionals, carers, but also venture capitals, also researchers, also regional authorities, and also, of course, citizens, like older people, organizations. So together, we organize a very light governance structure, just a steering group composed by 33 high-level personalities, ministers, CEOs of the companies. One of the CEOs is representing the pharma industry, but also other industry like ICT industry, like mobile technology industry, like food industry, or venture capitals are as well represented. They are also represented in the steering group, the owners, the member states owners and directors of the big joint programming initiatives. And this is the joint programming initiative for neurodegenerative diseases, but also the joint programming initiative on demography, more years, better lives. And together, we started this process just 1 year ago, because I didn't tell you that one of the conditions that the head of states put on us very strongly is to deliver very quick, because one of the challenges we have is to deliver results, to deploy innovation. So they gave us only 1 year to set a high-level steering group and to prepare a strategic plan. And this was in November last year. So now we are in November 2011, and we finally, together, we just published last 2 days ago, the strategic implementation plan. And this is what I would like to present you, because there are certain specific actions that's going to concern you and maybe to interest you. I would like to explain that this partnership is not about legislation, as well, a little bit on legislation, but basically is oriented and focused on actions. What we want is from Brussels to produce, to mobilize actions at local, regional, and national level. This is why together in the steering group, there are also two commissioners, the Vice President Nelly Cruz, responsible for the digital agenda, and John Daly, my boss, responsible for health and consumers. Together with the other 32 high-level personalities, they decided that the target of this partnership is to increase by 2, as an average, the healthy life years in Europe. But this is a very nice target. Some people say that's very ambitious and difficult to reach. Others, they say, well, if you increase the life expectancy, it's not so difficult. But what for us is very important is not just the target, is that we want to reach these targets by 2020 doing or reaching 3 objectives at the same time, is what we call the 3 objectives. And these 3 objectives is to promote that the citizens in Europe are healthier, are more active and independent until they are old age. The second objective is to promote and support that the social and healthcare systems are more efficient and are more sustainable. And the third important objective is to support and develop competitiveness and opportunities for our companies, not only at European level, but also at global level. Of course, with these 3 objectives, you can see that for us, we present aging as a big opportunity to develop a new market in Europe. You know very well, because you are dealing very often with elderly population, but it's not just representing opportunities for the pharma industry. It's in general a new silver market that is going to be open for all type of companies. And we want to put the conditions to develop this future. Another interesting thing is that this partnership is not containing any money. This is not about money. We are not going to found any new program. This is not a new FP7. This is not Horizon 2020. This is not CIP. This is just a new way of doing things. And the new way of doing things is just to use what is there, use it better, use it in a more efficient way. And this is about facilitating what is already here to be scaled up. The results of the research that they are still in the shelves of certain offices in Brussels or in certain capitals, we want to translate, we want to deploy this at in the real life. We also wanted to, as I say, to use and to join up the resources we know we have, not only at public administration, but at companies level, and we use better the expertise. For doing that, what we would like to do, or which we have done a little bit in the strategic plan, is to identify the gaps, to identify what are the problems, why innovation cannot be translated in this particular sector, and by identifying, try to put solutions, try to bring together solutions to speed up the innovation at real level. And of course, for doing that, what we need is to have a general framework, conditions that allows companies, hospitals, public authorities to do the work. And this is our task. This is the task of the Commission. This is the task also of public authorities. We are talking here about improving regulation or legislation which is not adequate. It's about standardization and, in some cases, interoperability between the different systems. But this is also about aligning funding, aligning all the funds that already exist. Just have a look on this. This is just some of the funding instruments we have at EU level that can make a difference if they would be very well used, and for the moment are just completely separate and completely dispersed. What we propose is just taking from the European regional funds until the very poor public health program, try to align the priorities, try to orientate the future priorities to use better the budget we have, try to get synergies between the different instruments, try to coordinate them better, and try to use them efficiently. Just to give you an example, structural funds, they have an allocation of 5 billion euros for health priorities. Until now, still we have 2 years, but until now, less than 20% of this money has been used at regional level. Why? Because probably health is not a priority in certain regions. They prefer to build up motorways. Anyway, that's the current situation, and what we propose is to use it better and to coordinate better this allocation. So the steering group, these high-level personalities, has decided that to make a change for aging population, we need to work in 3 big strategic priority areas. This is prevention, including awareness, screening, and early diagnosis. We need to work on care and cure, not only on cure, but care and cure together. And we need to work also when the people is not still disabled. We need to keep them active and independent to be productive in the society. Of course, these need to be framed by horizontal issues, as I told you. And just I would like to underline that we don't understand here innovation just as a technology. We understand innovation as well as a new way of organizing business, a new way of business models, an innovative manner of presenting services, but also using social innovation. So the concept of innovation can include all these elements. But of course, we receive a lot of interest, a lot of expectations. Your companies, they came to see us and they say, well, we want to do plenty of things because there is a big potential here, but how to decide what is inside and what is not inside. Then the steering group has fixed several criteria to see when an action can belong to this partnership. The first criteria is that the action needs to contribute to the objectives, these famous 3 objectives I told you at the beginning. That means that the actions need to be quantifiable, needs to deliver results, and we need to quantify these results. The second criteria is that the actions need to be conceived in a multi-stakeholder approach, need to have a kind of element of partnership. That means that one of your companies cannot just present a new treatment for the partnership. If you want to present something new, you have to bring together the stakeholders, the patients, the health professionals, the other actors that can be relevant, and present this in a partnership manner. Of course, the third criteria is that these actions need to make a difference to the problem. We need to overcome some of the barriers we have identified. And finally, they need to contain an action, an important dose, an important element of innovation. We know that, doing physical activity is very important for keeping fit at old age, but just organizing a yoga classes in your little town, this is not enough because there is no innovation element. Well, what we will request is to have an important innovation, this broad concept of innovation in the actions. And of course, as we have to show that this new way of doing things in Brussels gives results, they put us a kind of time constraint, and they say, okay, the actions need to be ready to launch. We want to have already some results in the next year. So we have 1 year to produce some results. Of course, with this situation, and after having done a very broad public consultation, nearly 600 answers, and more than 200 actions for 200 commitment for actions, the steering group has grouped actions in 5 blocks, what we call the specific actions. Those actions, you remember, that should be ready to launch. And these specific actions are 5. The first is a big programs at regional level on prescription and adherence. Well, you know better than me how important is adherence to treatment, how if you want to show the results of health outcomes of your treatment, of course, you need to adhere to your treatment. This is a very important difficulty. This is also linked to behavioral factors, motivation, skills, information, etc. And the action will be around the actors of this problem, which are not only the pharmacists and the health professionals, but also carers, industry, patients, and of course public administration. Here is as well about using innovative instruments, ICT tools, new organizational models to promote adherence to treatment. The second specific action is a program as well at regional level. We want to mobilize more than 30 regions to have programs on personal health management in order to prevent falls. Falls, you know, is a key determinant for mobility and for active and independent living. And what we want here is to use innovative tools for detection and screening of, for instance, sarcopenia, to really prevent these falls, that they are a strong and important burden at economic level for our health systems and, of course, for our citizens. The third action is about avoiding the functional decline, avoiding frailty. For that, also, we envisage a program at regional levels. We want to mobilize regional groups to put in place new diagnostic tools for early detection of, in particular, malnutrition. You know, malnutrition is an important key determinant as well for frailty. More or less 50% of malnutrition is undetected at the moment for people more than 65. And we consider that this is an area where we can obtain very quick and useful results. As well, here is about care providers, it's about companies, public authorities, patients, carers, etc. The fourth action is about to develop, to implement, to replicate models for integrated care for chronic conditions, including remote monitoring for and sorry, because it's the next slide, because I wanted to develop a little bit more, for integrated care for chronic conditions. Here, what's really we want to promote is to use models, best practice models already existing at regional level, and try to promote it and try to replicate in other regions, in other areas. We wanted here to promote ideas on implementing and developing and implementing protocols, education and training programs for care force and health professionals. And we want to address specifically here multiple chronic conditions, multimorbidity, and in particular more research on multimorbidity. We also wanted to use innovative tools like telemonitoring, like remote control, an innovative service to integrate these both aspects, care and cure, care and healthcare. For that, what we will mobilize public authorities, regional authorities, hospital, care providers, patients, social carers, and so. So I'm already out of my time, I think, 2 minutes. Just to come back to explain you the fifth action, which is about developing in the interoperable solutions and business models for active and independent living. This is more about devices, personal devices, and also to facilitate joint procurement for this type of solutions. But also, there is a package of actions that concern the Commission and the public authorities. I speak at the beginning about the need to put a little bit of order on the funding, but also we need, and we will commit as a Commission, to revise certain type of legislation, to adapt certain legislation, to develop standards for interoperability of the solutions, the innovative solutions. Just give you an example. If you are developing a biosensor in Catalonia, in Spain, the country I know the best, and you try to sell and to implement your solution in the south of France, you can't, simply because the standards used in France and in Spain are different. So one of the main tasks we have here is to put a little bit of order in this type of standards and make things interoperable at EU level. Also, you know very well there are problems on data protection. If you want to put electronic records really in place, probably we need to think about new ways of treat the data protection. And of course, we need data, a lot of data, reliable data, comparable data, evidence, because in a lot of cases, the lack of evidence makes that public health authorities, they don't buy innovative solutions, they don't buy innovative treatments, because the argument is, we don't have money and you have not a clear explanation that your cost-benefit analysis make us save some money. So what we want is to put in common this type of data, methodology, we are talking also here about health technology assessment, and make it in a more collaborative way. And finally, another idea that the Commission is committed to do is to set or to organize an open and virtual marketplace for new ideas, new innovative solutions to find together actions, ideas, funding for networking, etc. Because in this area, there is a lot of projects, there is a lot of things going on, but they are completely disconnected, completely linked. And what we want to promote is a very easy way of getting in contact with others. Well, this is the strategic plan that the steering group has prepared. So we have a common vision. Aging should not be a problem, should be a source of opportunities. But the condition is that we have to do that in a multidisciplinary way. This foundation supports three big pillars: prevention, care and cure, and active and independent living. And we have a common roof. We have the need to have a common framework to work, to do things together, to cooperate together. As I say, well, this I think I don't have time, but just to give you an idea that we want to deliver results, quantifiable results. So we are working in a very sophisticated mechanisms of indicators and monitoring, really to measure what type of action gives some results to make the reality of increase to healthy life years. Just to tell you that with this idea and with this strategic plan, we are going to the Competitiveness Council in December and at the same time at the Health Council to present exactly the same that I just present to you today. And at the beginning of January, the beginning of 2012, we will launch calls for action. We will launch calls for commitment, for involvement. And we will present a communication with the commitments of the Commission to be adopted by the Danish presidency in June. Thank you very much. And if you want to see the strategic plan, this is the place. Thank you very much.